President Biden's chief medical advisor, Dr. Anthony Fauci. Dr. Fauci, thanks for joining us again this morning. Start out by responding to Nate's argument right there that the pause may have hurt more than it helped.
No, I don't think that's ultimately going to be the case, George. I think when we get now back in tune with getting this vaccine, not only here in the United States, but also globally, because the rest of the world was looking at the United States decision, particularly because they know that the CDC and the FDA are the gold standard for both safety and the evaluation of efficacy. I think in the long run, what we're going to see, and we'll probably see it soon, is that people will realize that we take safety very seriously. We're out there trying to combat the degree of vaccine hesitancy that still is out there. And one of the real reasons why people have hesitancy is concern about the safety of the vaccine. And I think if you make the argument that we take safety really very seriously, and there was a pause, it was examined, and now we're going ahead with it, which tells you that if you look at all of the other vaccinations that have been done, we've had about 141 million people have received at least one dose of the vaccine. A very small proportion of that, about 8 million, has been J&J. The rest have been the mRNAs from Pfizer and from Moderna. So if anybody has any doubts about the safety of those other vaccines, and including J&J, we can now say, we take this very seriously. We've looked at it. Now let's get back and get people vaccinated. And that's what we're going to be doing, get as many people vaccinated as we possibly can, as quickly as we can, because we have a very, very effective vaccine for the people here and throughout the world.
We have seen vaccination rates level off, coming a little bit off their highs from the last couple of weeks. And you still see pockets of people resisting the idea of mass vaccination. One of the most prominent skeptics is Republican Senator Ron Johnson of Wisconsin. Let's show what he had to say.
The science tells us that vaccines are 95% effective. So if you have a vaccine, quite honestly, what do you care if your neighbor has one or not? I mean, what is it to you? You've got a vaccine, and it's, science is telling you it's very, very effective. So why is this big push to make sure everybody gets a vaccine?
What's your response to that?
Well, the fact is that people who have been infected in this country now and have died, if you look at the numbers, there's been about 570,000 Americans have died. We have a highly efficacious and effective vaccine that's really very, very safe. That is the reason why you want everyone to get vaccinated. So I don't understand the argument, if I get vaccinated, George, and I'm protected, that you, George, don't have to get vaccinated. It doesn't make any sense. The more people you get vaccinated, the more people you protect. And there is the issue when you get a critical number of people vaccinated, you really have a blanket of protection over the entire community. So to get vaccinated, you have a responsibility to yourself to protect yourself. But also, even if you're a young person who may not get any symptoms, you don't want to get infected. You may think it doesn't make any difference because you may not get any symptoms, but you may inadvertently and innocently pass the infection on to someone else who could have a serious consequence. So there's so many reasons why we should get as many people vaccinated as we possibly can.
Our situation continues to improve here, but there's a real crisis right now in India. Record cases 4 days in a row right now. It could spread across the developing world. Their healthcare system could collapse if the situation doesn't improve. What more can the United States be doing right now to help address this crisis?
Yeah. Well, we are doing things that we've mentioned before, part of COVID, $4 billion and other things, but we really do need to do more. I mean, I don't think you can walk away from that, and we are. Right now, even as we speak, George, there's discussions about really ramping up what we can do on the ground, oxygen supplies, drugs, tests, PPE, as well as taking a look in the intermediate and long run about how we can get vaccines to these individuals, both immediately now, as well as in the situation where you help them to be able to essentially make vaccines themselves. So bottom line, George, it's a terrible situation that's going on in India and other low and middle income countries. And there is more we can do. And I believe you will see shortly that all these things that we're talking about are on the table, and we will be moving towards that.
We have about 30 million
proper
doses
thing
of
to
that AstraZeneca vaccine that aren't approved for use here. Shouldn't we just be sending that over?
You know, I think that's going to be something that is up for active consideration, George, certainly. I mean, I don't want to be speaking for policy right now with you, but I mean, that's something that certainly is going to be actively considered.
Let's talk about masks. I mean, you're seeing more and more talk about it. I know the CDC is looking at perhaps revising their guidance about wearing masks outdoors at this time. What's your best guidance on that at this point?
You know, I don't want to get ahead of them, George, but I think it's pretty common sense now that outdoor risk is really, really quite low. Particularly, I mean, if you were a vaccinated person wearing a mask outdoors, I mean, obviously the risk is minuscule. What I believe you're going to be hearing, what the country is going to be hearing soon, is updated guidelines from the CDC. The CDC is a science-based organization. They don't want to make any guidelines unless they look at the data and the data backs it up. But when you look around at the common sense situation, obviously the risk is really very low, particularly if you're vaccinated.
So we're heading towards normal.
You know, in some respects we are, George. It really is a challenge. We have vaccines now. The more we take a look at the data as it accumulates, we see it is even more effective than what the initial numbers of the clinical trial. And we're doing very well. You know, we now have more than 30% of the adult population is fully vaccinated. More than 50% of the adult population is getting at least one dose, which gives them certainly some protection until they get the next dose. So we now have been giving to people the answer to the issue of getting back to normal, namely the question you just asked me. But the only issue, George, that is something we need to pay attention to is that we're having still about 60,000 new infections per day. That's a precarious level, and we don't want that to go up.
Dr. Fauci, thanks for your time this morning. Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.